Well, hello there, everyone. Welcome back to Midwife Par Excellence. I am your registered midwife, Bernard. Today, I will be talking about the pap smear test. And, ladies, let me tell you, it is very important to do your pap test. The pap test, it is used to rule out cervical cancer. It can also detect certain vaginal infections such as a yeast infection, bacterial vaginosis, trichomoniasis vaginalis, and some others. So it is very important that you know your status, ladies, right? Now, a speculum is placed into the vagina, and let me show you what a speculum looks like. This is what the speculum looks like. So it has a little thing right here, right? So we lubricate with water and we go inside the vagina and we open up the speculum to view the cervix, right? Once the cervix is viewed, now we're gonna use a little brush. Now, persons have said that we take off things off of the cervix. Nobody clipping off anything off any cervix unless you're doing a biopsy, right? For other purposes, for diagnostic purposes, right? But for the pap smear, the speculum is inserted, the cervix is located, and this little brush here, look at it. This little brush right here, see it? Very, very soft. It is inserted just about the cervix, and a little sample of the cervical components are taken. Nobody cutting off anything here, right? Then this is the slide, right? This is what we call a pap smear slide, and the client's name and the health center or doctor's office that is coming from and the date when the sample was taken. Then it is placed on the slide. Whatever we got from the sample of the cervix, the little components, and we just glide it along on the slide. A little fixative spray is used to preserve the sample, so it is sprayed on there, right? And this is what is sent to the lab. All right. Now, the process should not be painful, just a little uncomfortable. Of course, you know something going in the vagina, so of course you're gonna feel a little funny. All right, so we have the metal speculums, and there's also some plastic ones, clear plastic, right? The metal speculums come in various sizes, so the nurse will be, based on her assessment, will determine what size speculum to use for each client. Now, as I said before, it's a little uncomfortable. It shouldn't be painful. Bear in mind that when you go for a pap test, your breasts will be examined also. Your abdominal examination will be done. A vaginal assessment will be done, and at that time the sample will be taken for your pap smear. Now, ladies, remember to follow up on your results. All right? You want to follow up on your results, even though you will be contacted if there's any abnormalities. We still want you to follow up on your results, all right, so you know your status. We also recommend that you do your pap test every year, and after about 3 normal readings you can start doing it every 2 years. But there are some clients who will be required to do it every 6 months, or based on what the assessment is at the reading of the pap smear. All right, so get your pap smears done, ladies. Trust me, it's simple. It's nothing. Like persons have been saying, and there are times when persons don't do the pap smear because of what other persons' experiences are. It is very important that in health world you experience things for yourself, right? So I encourage you, ladies. April is Cervical Cancer Awareness Month. However, every health center offers pap smears, and the doctor's office provides pap smears also, right? So please head to your nearest health center to your home and find out when is their routine pap smear day and get your pap smears done. However, for the clients who are 6 weeks postnatal, it is routine that your pap smear be done unless otherwise advised at 6 weeks clinic, that your pap smear be done before you leave that health center on your 6-week visit. All right, so ladies, be prepared. Be in the know with what is happening with your body, and you will be fine. All right? It was your midwife par excellence, as usual. It's nice seeing you, nice having you, and we look forward to seeing you all the time. Thank you for your subscriptions. Thank you for your sharing here at Midwife par excellence. Thank you all.